So we can emotionally support you. We can help optimize things that are happening in a cycle. But in terms of really being the factor that makes the difference, or even sometimes obviating the need for IVF or figuring out why people need IVF, that has to be done before somebody's doing IVF. And I think there's a huge consumer education piece in that, because IVF clinics aren't there to answer the question, why do I need IVF? They're there to say, how can I give you IVF and how can I get the best response for you? But the work that needs to be done is in why do I need IVF? And that's why I train people to be detectives, because I want to understand why. And that's not to say there isn't absolutely a place for IVF that's hugely important. And I do work with clients who've done their work and then I'm like, right, you're ready to conceive now and you'd like to do IVF? Fine, I'm all there. But it's been a long time since somebody has done that work with me and done an IVF cycle and not had it be successful first time. Because everything we've done is optimized their health. And then they go on and the IVF is like the icing on the cake. But it takes 3 to 4 cycles to completely change the uterine environment, the hormonal environment. It takes time to change things. So to expect a practitioner to make a difference to your IVF cycle without that 3 to 4 cycles, I think is unrealistic. So I train practitioners to really educate the public about how can I'm going to spend £10,000 on an IVF cycle. How can I make that really work for me? It's to spend a little bit of time and energy getting your health optimized before you get there. And of course, we're only talking about women's health here, but it behooves me to say that actually men are 50% of that equation. And the IVF process, the IVF factory is a very patriarchal factory. So they don't have many tools. If the sperm isn't good, they'll give ICSI, which is where you go in, the embryologist goes in, finds a sperm which visually has good DNA. Doesn't mean the quality is good, but visually has good DNA. They go in, they capture the sperm, they break its tail, and they put the head of that sperm inside the egg to try and make that embryo. But, we don't know the epigenetic ramifications of that yet. A couple of years ago, the first boys that were made with ICSI were old enough to give sperm samples. And I think it's very clear that in many of those cases, the problem that they caused their fathers to need to do IVF and ICSI was there in the child, which meant that child really needed to do IVF as its only option to make children. So we want to get behind that and we want to ask, why is the sperm like that? And we know that sperm quality has declined by 50% in the last 50 years. There's a hugely robust evidence around that. For anyone who's interested, there's a wonderful book called Countdown by an American professor